Hello there and welcome. My name is Tim Moore and I'm pleased to present Research Snapshot number 12 on behalf of professionals and researchers in early childhood intervention, commonly known as PRACI. I'm here on the lands of the Boonwurrung people of the Eastern Kulin Nation, and I acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. Today, the paper we are discussing is Effects of Preemptive Intervention on Developmental Outcomes Among Infants Showing Early Signs of Autism by Professor Andrew Whitehouse and colleagues. PRACI chose this article because of its relevance to a couple of crucial questions in early childhood intervention. How early can and should we start with young children, and what should we do? What kind of intervention should we use with the youngest children? So, some background. Interventions for children with autism usually don't start until after they've been diagnosed, which mightn't be until they're 3 years or older. However, we know that autism is a strongly heritable condition and that it's present at birth and emerges over the first 2 years. And that poses the question of whether it's possible to intervene early during this crucial developmental phase in development to address emerging developmental challenges and reduce the subsequent severity of the behavioural and social problems that the children experience. Previous efforts to intervene before the emergence of autistic symptoms have not succeeded in reducing the emergence of symptoms, but new evidence about early development and new techniques for promoting parent-child interactions have suggested a different intervention strategy that might be more effective. So the aim of this particular intervention was to help support social communication skills early in life with the aim of reducing the impact of these difficulties on subsequent development. And the intervention involved the iBasis video interaction to promote positive parenting, which uses video feedback to increase parental awareness of the infant's individual social communication and to guide their responses to build infant social engagement and interaction. So parents are videoed interacting with their baby in everyday situations such as feeding and playing, and then the therapist can provide guidance to the parent about how their baby is trying to communicate with them, how they can respond, and how they can have back and forth conversations, proto-conversations with the child. Such exchanges lay the foundation for early social communication development and for more complex skills, such as verbal language. So what did the researchers do? The study was delivered in 2 sites, in Perth at the Kids Research Institute Australia and in Melbourne at the Olga Tennyson Autism Research Centre at La Trobe University. The study took the form of a randomised clinical trial of the iBasis VPP intervention conducted over a 5-month period with some developmental follow-up. So assessments were conducted at baseline, the beginning of the intervention, 6 months, which is at the end of the intervention, and then 12 months and 24 months. And the participants were 104 infants aged 9 to 14 months, showing early behaviours associated with later autism diagnosis, such as reduced eye contact, imitation, and social smiling, as measured by a particular scale, the Social Attention and Communication Surveillance Scale Revised. So this is the randomised trial. 50 of the infants were randomised to receive 10 sessions of the iBasis VIPP therapy for 5 months, and the other 53 received the usual services they would receive in their local community, such as allied health therapy, working with psychologists, etc. When the babies were aged 3, after the treatment had completed, independent clinicians who didn't know which therapies the children had received reviewed all of the developmental information collected and determined whether the children met diagnostic criteria for autism. So what did they find? First, there were improvements in caregiver responsiveness and language outcome in the IBASIS VIPP group compared to the other group. Secondly, at age 3, the children in the treatment group had significantly fewer behavioural signs of autism, such as social communication difficulties and repetitive behaviours, compared to the infants who did not receive the therapy. And the infants who received the therapy were also less likely to meet criteria for an overall diagnosis of autism when they were 3. Overall, the findings provide support for the efficacy of this therapy model with infants showing early signs of autism. So how can you use this research? There's a couple of features of this that are worth noting. First, many previous therapies for autism have tried to improve development by working directly with the children to shape more normal behaviour and reduce behaviours that are seen as problematic. This new therapy focused on providing supports to children based on functional difficulties rather than behavioural symptoms, and sought to promote positive interactions rather than eliminate problem behaviours, a very important distinction. Secondly, the therapy does not work directly with the child, but with the child's social environment, seeking to help the child's caregivers understand and respond to the child's communications more effectively. And we know that this is consistent with best practice in early childhood intervention services. Implications for practitioners and services. Well, the findings suggest that rather than waiting until the child is diagnosed to provide early child intervention support, we should try to identify developmental differences as early as possible and provide support during that early period. This study has obvious implications for children showing early social communication difficulties, but these are not restricted to children with autism. Promoting responsive caregiving is important for all children with developmental disabilities. The use of video feedback in promoting parent-child communication obviously can be a valuable addition to early childhood intervention practice. Where to from here? Well, the team in Western Australia that Andrew Whitehouse is leading has now got a community-based service based on this intervention used in this study. And they've also published a couple of papers further on this research. One on what emerging autism features at 12 months are associated with later parent-child interaction, and the second one on the therapy costs and downstream cost consequences of using this particular intervention. The researchers involved, as I said, the lead author was Professor Andrew Whitehouse, Bennett Chair of Autism at Kids Research Institute Australia at the University of Western Australia. There were no less than 35 co-authors for this paper from a number of institutions, including Telethon Kids Institute, which is the old name for Kids Research Institute Australia, the Olga Tennyson Autism Research Centre, Cooperative Research Centre for Living with Autism, La Trobe University, and University of Manchester. Here's the citation, and thank you very much for listening. You can don't forget to visit the Pacey website for more research snapshots and to sign up for our newsletter.